I have a question here from one of our social media platforms. This lady asked us, she's 38 years old and wanted to know her options for her hairline. She wants to fill in the temples here, maybe lowering the lower part of the frontal part of the hairline too. So real quickly, what are her options here? Now, of course, I'm assuming that she's healthy, that the hair loss has been appropriately diagnosed. I'm not seeing her in person, so this is not supposed to be a recommendation for treatment, but in general, if she is healthy, if she is not having any other hair loss, if the diagnosis here was a typical genetic hair loss, her options will be great for transplants. We can actually use smaller hair grafts to round up her temples here. Right now they look a little bit receded, so we can round it up, make it a little bit more of a heart-shaped hairline, which usually does very well for ladies. We can also fill in a little bit of her frontal area here, which has a little divot, which is not uncommon. I don't know if the camera can capture, but you can see how it goes a little bit in right there. I have patients who want to keep that. It's their traits, it's their family, is all like that. So that'll be an option too. She doesn't have to do it, but if she wanted to round it out a little bit more here and bring this little divot and flush it out with the hairline and also round up the corners, she'll be a great candidate. Again, assuming that everything is good. So lots of good options for women as far as hairline reconstruction. We also have the hairline lowering procedure, which probably wouldn't apply to her here. But anyway, the first step is the consultation. So that way I can evaluate, I can make the right diagnosis. If you have the right diagnosis and the great treatment plan, then you have success, right? So if you're out there with the same situation of the hairline, there are great options. Hair transplants are really natural nowadays. So come talk to us and we'll discuss your particular options, okay? Thank you. See you next time.